Question number 381. A child who ingested the 15 maximum strength acetaminophen tablet 45 minutes ago, so is seen in the emergency department. So which of these order should the nurse do first? Option A, gastric lavage PRN, and option B, acetylcysteine. Option C, start an IV dextrose 5% with 33% normal saline, and option D, activated charcoal. So option A, gastric lavage PRN is correct answer, because gastric lavage PRN, removing as much as the drug as possible, is the first step in the treatment for this drug overdose. Question number 382. A patient has been taking aluminum hydroxide daily for the 3 weeks, and the nurse should be alert for which of the following side effect? Option A, constipation. Option B, fluctuance. Option C, nausea, and option D, vomiting. So option A, constipation is correct answer. Question number 383. To maintain the airway and promote the respiratory function, the best position for the nurse to place the unconscious patient in the post-anesthesia care unit is option A, supine, option B, lateral, option C, Trendelenburg, and option D, follower. So option B, lateral position is correct answer. Question number 384. A patient with a history of angina pectoris arrives in the emergency complaining of headache, visual disturbance, and feeling dizzy, and your nursing assessment also notes he looks flushed and he perspiring the profusely and is experiencing palpitation. So you should suspect option A, an overdose of sublingual nitroglycerin, option B, the onset of a MI, option C, the patient has been over exercising, and option D, the beginning of a severe chest infection. So option A, an overdose of sublingual nitroglycerin is correct answer. Question number 385. An 85-year-old man is admitted with dementia. So he continuously attempts to remove his nasogastric tube. So the nurse applies the cloth wrist restraint as ordered. So which of the following action by the nurse is most appropriate here? Option A, evaluate the need to restrain by observing the patient behavior once every 24 hours. And option B, perform circulation check to the extremity every 2 hours. And option C, remove the restraint when the patient is sleeping. And option D, instruct the family to limit the physical contact with the patient. So option B, perform the circulation check to the extremity every 2 hours. Question number 386. In children suspected to have a diagnosis of diabetes, which one of the following complaint would be the most likely to prompt parents to take their school-age child for evaluation? Option A, polyphagia, option B, dehydration, option C, bedwetting, option D, weight loss. So option C is correct answer, because bedwetting in children, fatigue and bedwetting are the chief complaint that prompt the parents to take their child for evaluation, because bedwetting in the school age child is readily detected by the parents. Question number 387. A client come to the clinic for treatment of recurrent inflammatory infection. So the nurse recognized that this condition most frequently follow which type of infection? Option A, trichomoniasis, option B, chlamydia, option C, staphylococcus, and option D, streptococcus. So option B, chlamydia is correct answer, because chlamydia infection are one of the most frequent causes of PID. Question number 388. A client is unconscious following the tonic-clonic seizure. So what should the nurse do first here? So option A, check the pulse. Option B, administer Valium. Option C, place the client in a side-lying position. And option D, place a tongue blade in the mouth. So option C, place the client in the side-lying position is correct answer, because place the client in the same position to maintain an open airway and drain the secretion and prevent the aspiration if vomiting occur. Question number 389. The following a cocaine high. So the user commonly experience an extremely unpleasant feeling called option A, craving, option B, crashing, option C, outward bound, and option D, nodding out. So option B, crashing is correct answer, because following the cocaine use, the intense pleasure is replaced by an equally unpleasant feeling, referred to as crashing. Question number 390. Client with mitral stenosis would likely manifest finding associated with congestion in the option A, pulmonary circulation, option B, descending aorta, option C, superior vena cava, and option D, bundle of his. So option A, pulmonary circulation is correct answer, because congestion occur in the pulmonary circulation due to the inefficient emptying of the left ventricle and the lack of a competent valve to prevent the backflow into the pulmonary vein. Question number 391. In assessing the healing of a client wound during a home visit, so which of the following is the best indicator of good healing? Option A, white patches. Option B, green drainage. Option C, redness tissue. And option D, scar formation. So option C, redness tissue is correct answer, as the wound granulate. So redness indicate the sign of healing. Question number 392. The nurse is caring for the client with the end-stage renal disease. So what action should the nurse take to assess for patency in the fistula used for hemodialysis? Option A, observe for edema proximal to the site. And option B, irrigate with 5 minutes of 0.9% normal saline. And option C, palpate for a thrill over the fistula. And option D, check the color and warmth in the extremities. So option C, palpate for a thrill over the fistula is correct answer. To assess for patency in a fistula or graft, so the nurse auscultate for a bruit or palpate for a thrill. Question number 393. Which therapeutic communication skill is the most likely to encourage a depressed client to vent feeling? So option A, direct confrontation. Option B, reality orientation. Option C, projectile identification. And option D, active listening. So option D, active listening is correct answer. Use of therapeutic communication skills such as silence and the active listening encourages the verbalization of feelings. Question number 394. The nurse walk into a client room and find the client lying still and silent on the floor. So the nurse should first, option A, assess the client airway. Option B, call for help. Option C, establish that the client is unresponsive. And option D, see if anyone saw the client fall. So option C, establish that the client is unresponsive is correct answer, because first step in the CPR is to establish the unresponsiveness. Then second step is call for help. And third is opening the airway. Question number 395. The nurse is performing a developmental assessment on an 8-month-old child. So which finding should be reported to the healthcare provider? Option A, lift the head from the prone position. Option B, roll from abdomen to back. Option C, respond to parents' voice. And option D, fall forward when sitting. So option D, fall forward while sitting is correct answer, because sitting without support is expected at this age. Question number 396. The infant with Down syndrome should go through which of the following Erikson developmental stages first? Option A, initiated versus self-doubt. Option B, industry versus inferiority. Option C, autonomy versus shame and doubt. And option D, trust versus mistrust. So option D, trust versus mistrust is correct answer, because first trust versus mistrust only at a slow rate. So therefore the nurse should concentrate on developing on the bond between the primary care provider of the child. Question number 397. The child with phenylketonuria must maintain a low phenylalanine diet, and to prevent which of the following complications? So option A, irreversible brain damage. Option B, kidney failure. Option C, blindness. And option D, neutropenia. So option A, irreversible brain damage is correct answer, because PKU must maintain the strict diet to prevent the CNS damage, seizure or sometime eventual death. Question number 399. Drugs that dilate the pupil. Option A, myotics. Option B, keratolytics. Option C, myotics. And option D, mydriatics. So option A, mydriatics is correct answer. Question number 400. Application of drug to the skin is called option A, inhalation. Option B, insertion. Option C, instillation. And option D, induction. So option D, induction is correct answer. Thank you.